Welcome to ZOOMERTIMES TV. And here's your host, Anita Finley.
Hello, everybody. We have another Zoomer Times interview. I'm Anita Finley, your host. And, as a gerontologist, I am always very excited to talk to physicians. Being a physician is not easy. Besides all the technical work you had to go through, it's hard. So I have Dr. Ron Mathew, who is he's an osteopathic physician, which I told him before we got on the air that I'm very partial to osteopaths because they do have a different take on going through being with patients. They seem to be more, they really listen better. And I know a lot of physicians are going to be mad at me, but I have to tell you, my experience has been very good. So we're happy that Dr. Mathew is going to be with us today. So Dr. Mathew, you said that you've been well educated here in South Florida, so you know your patients.
Absolutely, that is correct. Yeah, I was born and raised here in South Florida, around the Fort Lauderdale area, and did all my schooling in that area too, elementary, middle, high, even med school at Nova Southeastern University. And then I had to come up here to Palm Beach County to fulfill my family medicine residency training over at Lakeside Medical Center, which is located out in Belglade and part of the healthcare district of Palm Beach County. So I spent a few years there, and now here I am working in Palm Beach Gardens as a full-fledged family medicine, or one correction, osteopathic family medicine physician here in Palm Beach County, Palm Beach Gardens, as well as Palm Beach County area. And yeah, I'm ready to serve and help you with all your primary care needs.
Yeah, well, we'll get you lots of patients because Palm Beach Gardens has just been growing like crazy. I remember when I lived in Boca for a while, and Palm Beach Gardens was pretty far up there. And then when Scripps Research came up there, and then they had Jupiter Hospital, but now it's really growing big time. So you're in a perfect place, and people are going to be very lucky to have you there.
That's exactly right. Yes, absolutely. As you know, this clinic here, I'm part of one of the newest clinics here for Healthy Partners here in Palm Beach Gardens, and we're every day just getting new patients. We're seeing tremendous growth, and we're still growing. Obviously, there's still a lot of things coming down the pipeline in the next several months. And for all of you watching, listening out there, please come on over, come visit. All of us here at the Palm Beach Gardens office are more than happy to welcome you. And I, of course, would be more than happy to be your primary care doctor.
Yeah, of course, he's busy, so you can't go in and have coffee with him, but you can make an appointment and ask to see him. And Healthy Partners now is a very big organization. They are reaching out all over, actually all over Florida. I know that, but I know they're right now they're concentrating in the Palm Beach Gardens area because it's new for them, and they're going to be very happy there. The residents, and not residents only, but the patients are very sophisticated. They've been living there, and they have a beautiful environment, and I know that. So where are you now living, Dr. Mathew? Do you have a family?
Yes, actually, majority of my family, they live over in the Fort Lauderdale area, Broward County, near Pompano Beach, Coral Springs, thereabouts. But me personally, I have moved up here finally to this area. So I don't live that far from the office, but yes, I am in the Palm Beach area, and still getting to know and explore bits and pieces of course, northern Palm Beach area. But like I said, I'm not exactly new to this area. Making all my commutes during residency out to Belglade and thereabouts, and of course coming through towards Loxahatchee, Wellington, and of course thereabouts in central Palm Beach. So like I said, yeah. Not exactly
it sounds
new.
like you've seen also, medicine is what we're going to talk about, and you've seen a lot, and as a physician and all you. But let's talk about screenings. That's something that I don't usually talk to physicians about that, but will you tell us the value of screenings and what they're all about, please?
Yes, absolutely. So as a family medicine physician, we are, we'll call it ourselves like the gatekeepers, like the front lines of primary care. And what's also central to providing primary care for you, or not just, you know, um, you as an individual or families, what's also central to providing effective care is preventative measures. And so you see there are these guidelines, from the United States Preventive Service Task Force that kind of highlights all of these preventative care screening tests. And so when you come to see a family medicine physician, me, or any of your primary care docs, maybe a typical visit would be just checking in, giving information, medical history, and of course, maybe you'll have a concern or complaint in your mind, which, we'll do everything to address and make sure we have a plan for you. But also in our visits, whether, it's a second, third visit or so, we also try to address any preventative measures, such as, could be as simple as making sure your vaccines are up to date, flu shots, you get your COVID shots plus booster. And also it could also range into things further down the line, such as screening for colon cancer, breast cancer via mammogram. And back to the colon cancer, just doing, testing, whether it's through a, doing a occult blood sample or colonoscopy. The list just goes on. But just to give you an idea, the point is, we want to have you come meet with us so that we can make sure you're on track to wellness through the screening tests, and of course to address any of your concerns and, if necessary, medication management.
So, Dr. Mathew, when you talk about screenings, a lot of people don't really think about them, but I'm sure you've seen people who, through a screening, have now detected something that you've seen. And if you hadn't had a screening, they could just be living with it, because all things don't show up so quickly, do they?
No, they don't. It's a very good point, Anita. Actually, a lot of things that could be very subtle or, just looming in the background there, if we pick it up early with a visit or a test, maybe through blood tests, then the earlier, of course, the better. And of course, several examples to point out that, that you can think about. It could be as simple as, your blood sugar. It's are you at risk for diabetes? So, as part of our visits, aside from collecting information about your medical history, see if there's any diseases that run in the family, we also run, these screening and preventative tests to see if, risk for diabetes, is your blood pressure controlled, electrolytes, liver, kidneys, and, all the different blood tests, just as a first point of entry to see if there's any risk. And then, of course, following up on that to see, what if we can do something to make sure things are under control, or if we need to escalate it further to even an expert or someone that can help you. So, absolutely.
Well, that's a good point. So you really are the first stop. You're the first stop shop.
That's right. The gatekeeper.
Yep, do that, and then you would recommend someone who's a specialist. So let's say you detected something in their blood, you probably might send them to a cardiologist or someone that would help, right? And then do you stay in touch with them? And so it's like kind of a partnership.
Absolutely. And that's the thing. Even though, we take these steps, we do the tests, and of course we go to the next step, all these stepping stones, so to speak. The whole time, I am your primary care doctor. I am there with you every step of the way, whether even as you go see that specialist, or if you get have to go to an advanced level or whatnot, I'm still there, being able to provide guidance and, of course, interpretation tests, so to speak, I guess, aside from being, sort of the gatekeeper, also in some sense the cheerleader too.
Right. You're very friendly. I'm so glad that we're getting to talk to you, because a lot of physicians, unfortunately, some people say, I go to this great physician, he has no bedside manner, but he's very good. Well, I don't like that. I think that when you gain confidence, I can see that when people are with you, they're going to feel very confident. And as a physician, you will get to, I believe anyway, that by looking at them, being with them, listening to them, which a lot of physicians don't take the time to do, you find out a lot, don't you?
Absolutely. And that's one of the major reasons why I chose family medicine. This opportunity of full spectrum primary care from all ages, from the young to the elderly. And of course, here in our practice and with Healthy Partners, good majority, we definitely take pride in being able to serve the senior community, elderly. Well, of course, we take young adults too. But moreover, as you have pointed out, Anita, yes, it is that golden opportunity to sit down and take time to truly learn about our patients and the families too. I mean, it may not just be about just, the person. And I mean, if family members are there too, because everyone's, the, the bottom line is, this is a team effort, medicine, especially care for one, I mean, care for all, it's a collaborative effort. And I like that I'm being able to be a part of that, to get things started, try to lay the groundwork, making sure we're on the same page, and then in turn, being able to communicate that with other members of the team, be they doctors, nurses, or medical assistants, just the whole spectrum.
Right. Well,
all in that effort to make sure you're taken care of.
Yeah, that's really important. And because I put my gerontology hat on here, I'm sure you are aware of this, that a lot of people, especially the older population, going to the doctor's an event. It isn't like some younger people, oh, I've got to be there in 15 minutes, got to get back to work. This is the day they get their hair done, they get themselves fixed up because they want to talk to the doctor and to be assured that their life is going well. And I think from talking to you this short time, I think you understand that. And so you make them feel good, even if there's some news that they may not like, but that you can handle it.
Absolutely. And this opportunity, not only being able to connect with you and having you establish your primary care together, there'll be a mix of things. I mean, it's not just these lab tests, getting information, the referrals and all that, but yeah, I mean, if not just the good, if it also comes down to giving you the truth of, if there's something that's out of range or there's news or whatnot, I'm also still there to be that central person to help deliver that to you. And of course, more importantly, work with you on going in the way forward to making sure that your healthcare needs.
So Dr. Dr. Mathew, I'd like to give out the phone number for people to be able to make an appointment. Everyone get your pencils out. It's really important you put this on a pad. Don't put it on a yellow slip. You're going to lose it. This is really important. Could save your life. So this is the phone number for an appointment. It's 561-418-6200. Now I'm going to repeat that again. It's 418-6200 because it is in the 561 area code. Again, 418-6200. Now, when you call there, what will happen when someone calls there, Dr. Mathew?
So very likely you'll be greeted by a message, maybe have to push number or whatnot, but you will always, after, hearing the message, you'll definitely be in touch with one of our front desk representatives. Could be Nancy or could be any one of our medical assistants, and they will work with you from the beginning, make sure get an appointment, and if necessary, to connect with the rest of the members of our team. Aside from our front desks medical assistants, we also have a coordinator who can help with any insurance matters, getting you enrolled, making sure the right plan is there for you, and to assign you to me to you, sorry, as your primary care doctor. And so that's really the first step there. Just give the number a call, and our team is always standing by to get things started for you.
Are people now supposed to be wearing masks when they come in?
Yes, it is definitely required for you and expected for you to have your mask on as soon as you enter the lobby. And of course, my team members and I, we have our masks on to just out of caution.
Sure. And what is where are you actually located in Palm Beach Gardens?
So the address is 2543 Burns Road. And just to give you an idea of where it's located, if you drive towards Palm Beach Gardens Medical Center, on Burns Road, just keep going east on Burns Road, past the hospital, and right before you reach the intersection of Prosperity Farms Road, there's a medical plaza there on the left. Just turn right into Medical Plaza, and we are located right in the corner, the left, just towards the left, and you can't miss it. You'll see Healthy Partners, big white sign. We pretty much take up the leftmost corner of the plaza. And while I'm saying that, not only to give you awareness of the size of the practice and the location, I think it'll also be interesting for you all to note. Aside from me providing primary care, we also do X-rays. We also do basic X-ray services. We do have X-ray service here in-house, and we also have physiotherapy. And when you come on by to give us a visit, we'd be more than happy to tell you more about those services, the X-rays, as well as the physiotherapy, and see how that can benefit you.
Explain to people what physiotherapy is, please.
Absolutely. So physiotherapy is basically the service of just involving, it's just a mix of like physical therapy. It could be massage. It could also involve injections too. But basically, the main modality of it is for pain relief. In this day and age, right, we have a lot of dependence or reports of opioid abuse, and all of us out there are looking maybe for alternatives for pain management, pain relief, and that's where physiotherapy definitely comes in, especially for those of us with like chronic lower back pain or joint pains. There's definitely an opportunity here for where physiotherapy could definitely benefit you. Much of it, aside from muscle therapy, manipulation, or even using equipment, to try to get stimulation or relief for you, can also involve injections too, PRP injections to be in particular, and and that's really just the main crux of it. But yeah, if you are definitely interested, come on over and we'll definitely show you more about it.
So as the physician, are you in charge of all those services?
So my main job, I'm mainly the primary care doctor here, and I mainly manage the primary care aspects. The physiotherapy, which takes up the other half of our clinic here in Palm Beach Gardens, that section or division, we actually have a nurse practitioner who helps facilitate all of those things. Her name is Barbara, and like me, we both work very well together, seeing all the patients that come through in here, providing assessments, and just seeing what opportunities are there for those patients who may benefit from physiotherapy, and reflexively, if they have primary care needs or need follow-up, that's where I come in. So it kind of plays back and forth there. But to answer your question, aside from me, yes, we also do have nurse practitioners. and to help facilitate those needs.
And that's why it's called Healthy Partners, because
Yes,
they're our
there's a
partners, right?
partner.
It's not just you, but I see in your ad, it also says
Okay.
24/7 urgency care. Tell us about that.
Yeah, so even though, typically our hours 8 a.m. to about 5 p.m. most days through the, Monday to Friday, we also offer, service even after hours or throughout the day through the phone, where just give us a call if you have a med that needs to be refilled, or you'd like to, speak with one of the providers, you have a question or concern. Feel free to call the number. And we also have a team that can help you even during those after hours to address those concerns. And
That's very important, because a lot of people don't have to go to the hospital. They can be taken care of at an urgent care center. So is that a part of the Healthy Partners?
Yeah, so that's a great point. That's why we provide this number, to see if we can help address things before having to go to the hospital emergency room. If it's pretty simple that we can address over the phone, we definitely will do our utmost to make sure that's addressed. And also, if it's something that's beyond our ability to help address over the phone, we do also partner with many of the urgent care centers around here to help escalate or facilitate to the next level if necessary. So
if someone wants to get their booster shot, they haven't gotten it yet, or they want their flu shot, will they just call this number? And I'll give that to you again. That's 561-418-6200, 418-6200. So they don't really have to be a patient to get it, but they'll become a patient if they go there, correct?
ideally, yes. Start by call. Once you give the number a call, and once we have you, registered and schedule an appointment, that's ideally how it works. But yes, in case you're wondering, as far as the vaccines, not only we provide the booster, but we can also help you with the other vaccines that definitely, especially this is flu season, right? So we can help with that. Shingles.
I got mine.
Very good. I got mine too. Yeah. So.
But you have other things right there. So you're a full service medical practice. That's the whole point. So healthcare partners, and I love this in their ad. They say healthcare that feels like Florida sunshine. Now, that says it all, doesn't it?
Oh, absolutely. I mean, we just look behind. I mean, the sunshine. It's here the whole time. I mean, we got as far as the spacing, and a lot of natural light here. But yes, all in alignment and in tune with that.
Right, the happy feeling.
Providing all Florida sunshine.
Right. So do you have a lot of elder patients? Would you say that you have patients in their 90s?
Yes, I can definitely say that. In fact, I just saw one this morning, and definitely quite a few others from the past few weeks. Definitely 95, 97. So it definitely ranges in above 60s, even in the 90s. But it's a good variety. Those in those age ranges. Yes.
Isn't that, it's a wonderful thing. It must be for you, for a physician, to see people, and many of them are in not such bad health. And they come in their 90s, and they probably pay attention to what you tell them, because they want to be around a while, right?
Absolutely. That's the whole idea. The fact that they've come this long, lived this long, and me being a part of their primary care, their journey, I want to continue to keep it that way. And yeah, I'm really amazed, especially I just saw one that was 97 years old, still able to see, hear and acknowledge, everything that me and my team are doing for her. And yeah, that gives me great pride and motivation to just continue to come seeing her. And
don't be surprised when they start reaching 100 and more.
Yeah, I mean, I at first I was surprised, but now as things get better, and like, well, now it's a part of the way of life. So yeah, no, I'm happy to be a part of that success. If we can get them to 100 or even beyond, I know
Right.
it's
Beyond. Right. I
So-
wrote a book called Live to Be 100 Plus. I wrote that in
100 plus.
1992. So I'm there. I'm wanting this to happen. And
Absolutely.
so what would you, we're just about out of time, but I just wanted to know, so what would your advice be for someone who's older like that? What do you tell them? What's your, because they're your physician, you're the God to them, frankly,
God,
you're
yeah.
anything you say they're going to do.
I mean, back in the past, right? That would have been the mindset. But I just want to simply and humbly say, as a doctor, right? I know we want to do what's best for you. So what we say, what we do for you, it's always in the best interest of your health. But more importantly, especially in today's day and age, with COVID-19 and everything going around, communication and just that human element of just being there for each other is key here. So the way I look at it, my advice as far as continuing to live beyond what many consider it's not beyond 100 or so. I'd say definitely family relationships, just being able to connect with your loved ones, those near you, around you, understanding your health and your mood, everything. It's all a team sport, and just being aware that you're not alone, and
Right.
that you have us.
Good. Well, Dr. Ron Mathew, I have to tell you, it's been wonderful, Dr. Ron Mathew, and you're terrific. People are going to really like you. I can see that right now. We're so happy that you were on our show. And so everybody make an appointment, Healthy Partners. It's 561-418-6200. You're going to do so well there, and people are going to love to be your patient. So thank you very much. And we appreciate you taking your time. Now you can go back to your patients.
Anita, it's been a pleasure. Thank you again so much for having me. And to all of you out there, thank you. Please feel free to come visit, and I'll be here, and I'd be happy to be your primary care doctor.
I look forward to meeting
I'll
you
be
one
here
day.
for you.
So thank you very much. Okay, bye.
Likewise. Take care.